mic over to Dr. Filosof to present the case.
Thank you very much. I hope everybody's hearing me okay. I would like to thank you for featuring this case today, and I hope you'll find it informative. This is an active case, a patient of mine who is currently followed by me, and his family provided consent for me sharing details of this case with all of you. So this patient first presented to our healthcare system in March of this year with general complaints of weakness. According to the family, ever since early part of this year, patient was notably declining in both physical abilities and cognitive abilities. Wife noted that patient stopped driving, stopped using computers. He was not able to concentrate on his work. But in this particular case, he was very weak and was not able to get out of the bathtub, and that's why they called an ambulance and came to the emergency room. During the workup, there was no clear diagnosis that became available. Patient was not febrile, had no headache, had no rash, did not seem confused. He was just weak. And so with no particular follow-up, he was sent out of the emergency room. However, he returns 4 days later after having several syncopal episodes. And again, wife adds that he has not been himself. He continues to get weaker every day, very unsteady, slow in terms of his speech, slow in terms of thinking. And then he had these several episodes of syncope at home. Now then wife adds that since early part of January and more so a few weeks prior to the previous visit to the emergency room, patient started to develop intermittent low-grade fat temperatures. So those temperatures ran anywhere between 100 and 101. And they've seen by primary physician, obviously they were seen in the emergency room prior, and there was no identifiable source. During this visit, he had a chest x-ray done, and although he had no respiratory symptoms, and at that time had no fever in the emergency room and had no leukocytosis, and a questionable infiltrate on a chest x-ray, he was sent out on Levaquin for diagnosis of community-acquired pneumonia. This is his chest x-ray, so not very impressive, but the radiologist picked up on a couple of things. There was an area in the right lower lobe which appeared to be nodular, and then there was an area in the left lower lobe that appeared to be nodular as well. So they recommended follow-up after that visit. A month later, patient did indeed have a follow-up, and again, there is an area of this nodule here in the right lower lobe, and they did not mention the left lower lobe infiltrates at this point. So between March and this June, patient has been followed by the primary physician